Good day everyone, I am Dr. Devanand, a consultant breast and endocrine surgeon at Beacon Hospital. Today I'm going to share a little on the importance of breast screening. Most of us will be aware that Malaysian National Cancer Registry of 2012 and 2016 have indicated and reported that breast cancer is the most common cancer affecting women in this area. And of that, basically, cancer, we all know, is already the leading cause of death in many high-income countries and will be a major cause of illness and death in the next few decades in every region of the world. One of the great cancer control challenges of this century is to bring the benefits of effective interventions to as many people as possible, even in developing countries like ours, by having effective screening, early detection, and excellence in therapy and better management. Now, we all know that the global burden of cancer rises effectively, and over the last as many years and decades, it's been going exponentially high. Lung cancer, the most common cancer in men, and breast cancer, the most common cancer in women worldwide. And for a gist of information, 1 in 4 deaths are due to cancer alone. And we will not digest too much in terms of figures, for a simple reason that in the last even 10 years, the number of cancers has increased from 12.7 million to almost 18 million, almost a 50% increase in just about a period of 10 years. Of course, exponentially, the number of deaths have also increased. Now, when we talk about breast cancer alone, in 2012, WHO reported 1.7 million breast cancers worldwide. But that numbers have increased in just a period of 6 years to almost 2.09 million. That is a huge increase. And if we talk about Asia alone, and 3 of the more prominent countries we have are China, Japan, and even Indonesia, the number of cancers in 2012 was about 404,000. That's almost about 24% in Asia. And of the 291,000 women with breast cancer, 81,000 women died of the disease. So it goes to show that while the number of cancers have been increasing, the number of cancers and breast cancers in Asia has also been increasing rapidly. What about Malaysia? In Malaysia, a Malaysian woman has about 1 in 20 lifetime risk of developing breast cancer. When I use the word lifetime, means if you survive to the age of 85, 1 of 20 women would be a candidate for breast cancer. Now, in breast cancer, which is about 31% in Malaysian women, the more important part is not to only talk about cancer of the breast. Remember, there's cancer of the cervix. Until about 10-15 years ago, which was number 2, colon cancer was number 3, uterine cancer was number 4, and ovarian cancer is number 5. But today, the numbers have changed. Breast cancer is still the top breast cancer as in incidence in women, but colon cancer has also rose to about 11% in our Malaysian women. So we are already digesting the fact that cancer in women not only involve the cervix, ovary, and uterus, but also colon cancer. So beware about colon cancer. Now we look at the statistics. Well, we have statistics up to 2016. WHO has reported that we are expected to have about 7,500 women with breast cancer annually, and with about 2,500 deaths as a result of breast cancer alone. Now that number is already equivalent to about 30 to 40%, which is very, very high in terms of cancer death. The bigger prominent issue is the fact that breast cancer in this country is being detected rather late. Almost 42% of women are presenting at a very late stage, as in stage 3 and stage 4. And that is a significant number, and that number has not shifted from 2002, almost 18 years ago. Why are we detecting more advanced disease and increasing number of deaths? 40% in advanced stages, but there's huge lack of awareness about the importance of breast screening, and of course there's also lack of regular screening. So it's not only about screening, but about regular screening. So the challenges today for us and for all women in this country is breast cancer has become the most costly disease to treat. especially when you come to stage 3 and stage 4. And the cancer deaths are also climbing in most countries in Asia, not Malaysia alone, in most Asian countries too. Simple mnemonics tells us it is always about advanced breast cancer detected late. It causes a huge cost in terms of management. Now, the bigger concern today, more and more younger women are being detected with breast cancer. Almost 52% are under the age of 49. When we say these are the young mothers, young aunties, women who have just gone into the industry to work, and so on and so forth. And what do we find a common denominator? There's lack of regular screening. There's also the so-called cancer registry, which is not exactly up to date, but nonetheless is helping us to define that there are still a lot of women who don't come in for regular screening. And we anticipate that in the next 20 years, the more women under the age of 50 will die of breast cancer, almost equivalent to maternal death. So, what do? We look at the common denominators. Well, we know about hereditary, we talk about genetic changes, we talk about age, we know aging population, people are living longer and longer, being exposed to a lot of environmental issues, and cancer does come up as a result of aging. We also talk about altered immune system. We are aware about the COVID-19 issue now, and we know the common denominator is about your immune system. If your immune system is not strong enough, you succumb to COVID-19. Now, the issue here is about some women will say, look, I do not have family history of breast cancer, so it's unlikely for me to be a candidate. Hereditary cancers only affect about 5 to 8% of women in this country and worldwide. So hereditary is not an issue. Almost 95% of women do not have a family history of breast cancer. The common denominators today, as we change our lifestyle, and in Asia, is basically smoking, obesity, and alcohol. Entirely a big issue, almost 40 to 50%. And we know women, as they age, risk of breast cancer increases in American countries or Asian countries, as versus Asian countries. More women are having breast cancer under the age of 49, almost 52.3%. So we have to focus, as doctors, consultants, as physicians, we have to focus on the young women because they become susceptible to breast cancer in Asia. We are not alone. All the 14 Asian countries have this common denominator under the age of 49. Our focus must be in this age group. Now we have got, and we have spoke about family history. Hereditary breast cancer affects only 5 to 8%, so do not be fooled with the fact that I don't have family history, so unlikely to hit me. But the issue is, we need to be educated about some of the common risk factors. One of the risk factors, we talk about age, we talk about family history. But the point is, as you go from the age of 12, or you go into the age of 20s and 30s and 40s and 50s, one common issue we have is the longer you are exposed to the basic hormone that is called estrogen, which all women have, the longer the exposure, the higher the risk of breast cancer. So if you have a puberty at the age of 12 and you don't get married, or you get married but you don't have any children, that means your breast is not changing in terms of character from those exposed to estrogen to otherwise, the risk of breast cancer increases, especially for women at the age of 35 and after. If you stay single, the common denominator basically is your breast tissue does not mature, you do not breastfeed, the risk of breast cancer increases. In the same way, if you get married and you have no pregnancy, and or you have menopause which is beyond the age of 51, 52, which is a common period of menopause, the higher the risk of breast cancer. What do we understand from all this is the fact that the higher or the duration of exposure to estrogen alone is a risk factor for breast cancer. We advise not to panic, but rather to come in and have regular examination and understand your breast. And we will talk to you about this on further down the line. The issue was, there are also women today taking long periods of oral contraceptive pills. Well, we know short duration contraceptive pills do not cause or do not propagate breast cancer, but long duration of oral contraceptive pills do initiate a process of cancer change. Similarly, hormone replacement therapy after the age of menopause. Now, When we talk about the growing prevalence of one of the biggest factors is obesity. The growing prevalence of obesity and overweight seen in every corner of the world. In this country, almost 49% of women are overweight or obese. And the numbers are not getting more. In fact, during the so-called MCO period of COVID-19, more women have put on a little more than 1 or 2 kgs in the period of the last few months alone. And this is already a warning signal that big trouble is on its way. And according to WHO, Margaret Chan, and she says this is going to be a big issue in the years to come. We know Malaysian women today at 49% are overweight and obese, but minding the fact that a BMI, when somebody says I'm overweight or obese, a BMI of 25 is for the Western countries or Western women. In Asia, it should be below 23, a BMI of 23. Now, it may be a little bit calculative how to do a BMI. Let me just give you a simple mnemonics. If an Asian woman averages about 160 centimeters in terms of height, you take away 100, and that leaves you a number of 60. That should be your weight, and that will be a BMI of 23. If you work around that figure and slightly below 60 kg, you're working on a perfect BMI of 21 or 22. You do not have to look at the charts. Height in centimeters minus 100 will give you a weight in kg plus or minus 2%, and you're fine. And that is your so-called ideal height and weight. Now let's raise another issue about obesity. We Asians consume too much food. There's a high calorie intake. We love our food. We love our corner. We love our restaurants. We love our night suppers and so on. A high raised calorie intake will cause obesity, overweight. At the same time, we also consume a lot of food that is high in saturated fat. And just like all Westerners and in Asia, we also reduce the amount of fruit and vegetable intake, and we also now slowly are having to reduce our physical activity, not only during the MCO period, but otherwise only about 18 to 20% of Malaysian exercise on a daily basis. Now this has got relevance because obesity and exercise, they go together. High intake of food goes together. So you need to reduce your food consumption to the sort of what you need to have per day in terms of calorie intake. And of course, you need to increase your fruits and vegetables, to increase your fiber intake while maintaining your protein values and so on. Now, an average Malaysian consumes almost 26 teaspoons of sugar per day. That's a WHO estimate, and we are supposed to only consume about 6 teaspoons of sugar per day. So be warned about your teh tarik and your coffee and your lime juice corner. When they put a lot of sugars per day, we consume cakes and we consume all kinds of bakery stuff, but you need to bring down the number of teaspoons of sugar to about 6 teaspoons per day if you're going to stay healthy. Of course, we should try and encourage women to exercise. That will help to bring your weight down. At the same time, we know exercise will help to regulate your hormones. Women who exercise regularly have regular periods every month. Women who don't exercise put on weight, and you find that instead of having 12 cycles of period in a year, you probably have 10 or 11. And that is an issue. Exercise could be of any form. It doesn't matter whether you do gardening, hiking, cycling, running, jogging, and so on and so forth, but do it on a regular basis and you will be the beneficiary of weight management, at the same time cancer management. Now, consumption has been increasing in women, and that is an issue because even moderate amount of alcohol intake increases risk of breast cancer, and we should, of course, we cannot say stop drinking alcohol. There's a choice, personal choice and social issue, but try and limit to about 1 unit of alcohol per day, up to a maximum of 3 to 6 per week. Anything more than that, you will increase your risk of breast cancer because alcohol goes through the liver, and liver is the same organ that helps to regulate your hormones as the estrogen and so on and so forth. Now, another issue which is increasing and slowly becoming a focus of attention is the so-called exogenous hormones or exogenous estrogen. Exogenous means estrogen that comes from outside, not within your body, it comes from outside. And that could be as a result of hormone replacement therapy, or it could be because of oral contraceptive pills, long duration of period. But the issue of the so-called xenohormones are coming from within your own environment, and that environment includes stuff that goes into the environment and lands on your skin and gets absorbed and they get converted into estrogen. Now, what are the common xenohormones? We call it xeno, means coming from outside. Pesticides, herbicides, car exhaust fumes, women who go into hair salons regularly to get their hair done, nail polishes, nail glues, dry cleaning chemicals. When you take your clothes back from the dry cleaner, you find you smell these the so-called smell from your clothes, so you know you're being exposed to all these kind of estrogens. Now, nearly all kinds of plastics, especially those which are disposable plastics, it's for the same reason we encourage, do not put hot items into so-called recyclable plastics, basically for a simple reason. Particles of plastic that floats into your food causes of basically changes in the hormones. Industrial waste, and that also meat from stock animals and so on and so forth. So xenohormones are hormones that we see on an everyday cycle of events, and these are the same stuff that goes onto you, into your body, onto your skin, and they propagate an increased level of estrogen, and we cannot understand why breast cancer incidence is not going down, and we think this is one of the common denominators. And on average, a woman uses almost 12 different types of cosmetics or personal care products on a day, and we also know cosmetic products may strip away our skin and also natural defense system. Now, if we look at one other areas basically which is important, is about stress. And I think all women go through stress, all of us go through stress, whether it is last as many months or otherwise. We know from the study from Hong Kong over a period, 10-year period, and they found that stress alone or increased pressure can cause over 2.5 times risk of breast cancer and even other forms of cancer because of hormonal influences. Women who consume a lot of dairy products, we Asians are not big consumers of dairy products. So when a lot of breast cancer survivors talk about, I cannot eat dairy products, well, you will say, look, a Chinese would not average drink milk or take yogurt. But on the other hand, women who consume a high amount of dairy product have an increased risk of breast cancer. In the same way, women who don't exercise or women who don't breastfeed, just like in Hong Kong, 72% of women who have breast cancer have been found to be because of lack of breastfeeding, 62% is related to exercise, and 40% is related to stress. So we encourage women as part and parcel of a risk factor or reduction of cancer, reduce your stress by doing regular exercise, meditation, and probably even yoga or Tai Chi. Whatever you need to do, reduce your stress. I'm coming to the bigger issue of screening. Can we reduce all the risk of breast cancer? We already talked about modifying your diet. We talked about exercise. We talked about reducing stress. Some of the common denominators we talked today is about vitamin D, because vitamin D has got to do with the immune system. We talked about omega-3, all of us know, all of us read a lot. It's an antioxidant, excellent, whether it comes from fish, salmon, soya, or otherwise. We talk about curcumin or turmeric, anti-inflammatory, right? It's already in the system. We also talk about trying to limit alcohol. Let's talk about the common issue as to why women are not detected early or do not do. That is regular screening. You need to have regular screening. So when we talk about screening, it's a simple issue about the fact that we encourage women to do breast self-examination, or in short we call it BSE. Now, you might Google and find out that, oh, BSE do not help in detection of early breast cancer. It's understood, yes. If you talk about Western women with a double D breast, having to detect a 1 centimeter cancer is almost impossible. But we talk about Asian women. So in a study that was done in Hong Kong way back almost 20 years ago, where Asian women to have an average A into B, if not C, and a single D breast cup size, otherwise it is very easy to detect up to 2 centimeters of lump in the breast. So we are different, definitely different from what you can Google and find out in the context of an average European woman and an average Asian woman. So we still encourage Asian women, or Malaysian for that matter, to do regular breast examination because a 1 centimeter or 2 centimeter lump. A 1 centimeter in an A cup breast is easily found very early. A 2 centimeter in a B cup is easily found. If you have got C into D, which is an average what we see among Indians and Malays, even up to 2 or 3 centimeter lumps can be detected fairly early. And that would talk about if there is a cancer, it's about a stage 2. Now, the next step of regular screening basically is about seeing your doctors. I'll talk to you about this in just about down the line, probably just about regular examination by doctors. The idea is to do a clinical examination. And of course, the other part basically is about coming in for the so-called imaging studies. And imaging includes ultrasound for those women under the age of 40 and doing regular mammogram after the age of 40. Now, when we talk about having to do regular screening, what are we looking for? We encourage women to look out for lumps, anything that has been different. When you examine your breast and you find that there is a lump in the breast and or otherwise there's lumpiness in the breast, or you find there's some kind of discharge coming from the nipple, anything that is different, just be forewarned and just look up and go and see your general practitioner, get on to see the doctors and understand what is this all about. And remember, 95% of lumps in the young are not cancerous at all, or rather they are totally harmless. So you should be looking out for any kind of changes in the breast that is different from what it was a month before or the month before that, and any of these changes should be just recorded and otherwise see your doctors. A lot of women during the period of the last so-called 6-8 months, because of this so-called MCO and COVID-19 issues, women have not presented themselves saying that, look, I can't come out, I can't do this, and so on and so forth. We encourage women to bypass all this issue, just get a routine check, because remember, most lumps that you feel in the breast are totally harmless. There are also, of course, benign conditions like simple, we call it adenomas, water bags in the breast, which is called cysts, which is all totally harmless. Some women get infection or abscess, those who are breastfeeding, they're totally harmless, completely harmless. Now, when we talk about screening mammography, mammogram is basically a valuable tool, which is because it helps to detect any kind of tiny lumps in the breast, which may be entirely non-cancerous, but on the other hand, it can even detect cancer when as small as 1 millimeter, 1 mm. That is how effective a good mammography is. Now, an average American would probably say about 70% of them go to regular screening. But in our country, only 15% of women go through regular screening. Only 15%, in spite of a 20-year journey of awareness and so on and so forth, we have not changed very much. Of course, 20 years ago, it was about 3%, it increased to 7%, now it averages about 15%. While in America or in Australia, about 70% of women go for regular screening. And that is why they detect almost 70% or 60% or 70% of cases as in stage 1, stage 2, whereas we detect only about 20 to 40% stage 1 and probably about 30% stage 2, the rest are in stage 3 and 4. So, mammogram picks up lumps as early as 1 mm. Remember that 1 mm in the breast in the cancer is a probably indicator of cancer basically, but it is as early as 6 to 7 years before the lump really becomes a full-blown cancer. You can detect cancer up to 6 to 7 years in advance of a full-blown lump. But by the time you come in with a 4 centimeter lump, which is what Hong Kong had about 20 years ago, basically, and they have been able to do regular screening, being an island state, and they were able to bring it down from 4.2 cm to 2.1 centimeter as a result of regular screening. So from stage 2, stage 3, they were able to bring the lumps down, or rather cancer staging, to just about stage 1, stage 2. So you see, an effective screening has definitely got an advantage in terms of early detection and of course good management. Now, many women are so afraid about mammogram, and of course the issue basically is some will say, look, I'm just 40 years old, if I do mammogram my breast will get damaged and you can't see too much, so why don't you do an ultrasound? Ultrasound only picks up lumps as small as 3 or 4 mm. You can pick up water, but it cannot pick up a cancer change as 1 millimeter or 2 millimeters. So mammogram is definitely the gold standard for screening today. Now, mammogram can detect even cancer change in the journey of 1 to 2 years or 3 years or 4 years or 5 years. So you find you have an advantage of trying to see, and you do not have to have surgery done for 1 millimeter, you don't have to have surgery done for 2 millimeter, but as you can come back for progress evaluation, screening mammogram will help to detect early cancer. Now the issue here is about why do we fail to do screening mammography? In Malaysia or in Asia, many women do not appreciate or understand the importance of screening, and that is why this whole educational process is all about. Many, even physicians and doctors, do not recommend for regular screening, and that is an issue we have been in the process of education. At the same time, those in the low income feel that mammogram is expensive, but glad to say throughout the country we have got more and more regular mammogram facilities available, and please enjoy the benefits of what the government is doing. Almost 23 government hospitals have all got, private hospitals have got, and now the quality of mammogram has also improved tremendously. This so-called failure has got through the fact that women are afraid about pain. They feel that by doing mammogram they'll have pain. Well, let me just assure you, if there's any kind of discomfort at all, it's just about a few seconds when the pressure is being applied on the breast. Pain is not something that you should try and worry about. Of course, we encourage you to have this mammogram done at a point of time when you're just about after your period, within 4, 5, 7 days of your period. Because when you come in during the mid-cycle, that's when the breast is congested, and or before your period, the breast is full of water in terms of retention, and you put a pressure on the breast, it can be a little bit uncomfortable. So the best time to get a mammogram done is just soon after your period. Now, many will say, look, I'm unable to miss my work, but we have to encourage all women to do this, because I think it's just about once a year, if not once every 2 years, so it's something that you can miss for about, just about half a day, so basically. The other issue is about women are scared about radiation. Will the radiation cause breast cancer itself? The answer is no. The facilities of what was 30 years ago, 20 years ago, and today have changed tremendously. The so-called minuscule radiation that you get from a screening mammogram do not cause breast cancer, and that is period. Sometimes women are afraid about bad news. That means they come in for mammogram and they get bad news. The answer is very obvious. If you come in for regular screening, cancer, if at all, it can be detected very, very early, and that is not bad news. That's rather good news for all women, because an early cancer will give you 100% survival over 5 to 10 year period and beyond. So we have another issue, that is about cultural inhibitions. And of course, we have changed over the last 20 years, the so-called cultural inhibition about sometimes like Muslim women who do not want to expose themselves to radiation or to expose themselves or the breast for the process of examination. Things have changed, and I believe that this culture change will also change as a result of understanding the importance of screening mammography. It has indeed changed. Now, the so-called fear of mammogram in terms of radiation, please let me reassure you and reassure you again. All of us are exposed to some form of radiation. Even when I'm doing this presentation, I'm being exposed to radiation from all the parameters around us. And an average person gets about 3 millisieverts. Don't worry about the terminology. 3 millisieverts of radiation per year. All of us have, whether it's in front of the television, microwave, oven, and so on and so forth. But a mammogram done once a year will only give you about 0.4 millisievert of radiation. Many of us go and have our X-ray of the spine done, and we don't think about it. Or have X-ray of the abdomen done, and we don't think about it. But the radiation exposure to the spine is almost four times compared to radiation exposed to the breast, which is 0.4, and lumbar spine X-ray gives you about 1.5 millisieverts. So do not be scared about the status of radiation exposure to the breast in the current terminology or change. Some will say, look, when you have this mammogram done, my breast will become flat. The answer is no. God has been very kind that the moment you do your breast mammogram, the breast comes back, does not go out of shape, it still maintains its shape, and so on and so forth. So do not be afraid. Right? Now, There's also the so-called bad news issue I mentioned to you. If you get detected early, the whole process about bad news is entirely good news. Detected early, simple management, sometimes no chemotherapy, sometimes just a short period of radiation, and plus or minus some kind of medication to treat. So when we discuss about breast screening, we talk about doing ultrasound for women under the age of 40, and which gives you about 60 to 70% accuracy rate in terms of detection if there's regular lumps, benign, and if cancerous. Whereas mammogram can pick up to 99% of cancers. So screening mammogram is a very essential tool in trying to bring the number of cancers down, if not early detection. So you need to choose to screen because it could save your life. And we are encouraging women, don't get scared, get screened, because for all reasons and all, we recommend that women at the age of 20 to 30 start doing your breast examination every month. Probably the best time to do your examination is just soon after your period, because that's when the breast is soft. You get to understand your breast. I would recommend that you have your breast examination done while lying down on your bed. Be comfortable. All right. For the left breast, you use the so-called 4 fingers on your right hand to examine the breast round the clock. You start from 12 o'clock at the top, 3 o'clock round the corner, 6 o'clock, 9 o'clock. When you understand your breast on a monthly basis, you begin to understand when changes takes place. And of course, sometimes we encourage you to look at the mirror, and there's any kind of orientation or disorientation of the nipple and or the breast in terms of size, volume, discharge. You know that any changes, just look out and get help from your doctors. Women from the age of 30 to 40, we ask you to do breast examination every month. At the same time, get to see your doctors at least once every 1 to 2 years, because we know from the charts today, the breast cancer incidence are slowly rising above the age of 30 to 40, almost about 13% in this country. We understand many women don't get married until the age of 29, 30, 31, 32, and they have their first pregnancy after the age of 33, 34. That gives you a window period of longer exposure to estrogen, and we do see a lot of women having breast cancer as early as 31, 32 years old. And that is a pity. And we encourage breast examination and regular screening. For women above the age of 40, if you follow the American Cancer Society protocol, from the age of 40 to 44, annual mammogram. And from the age of 45 to 54, annual or biannual mammogram. But my recommendation, after having in this practice for as long as I have for breast cancer work, I would recommend from the age of 40 to the age of 54. That is when we find a lot of the younger women in this country and a lot of women in Asia who have a higher incidence of breast cancer. Go in for regular screening every year to see a doctor, if not just for ultrasound, which is essential for those at the age of 40s and the 50s, because breast tissue is very dense, but you need to have mammogram done at least every 2 years. And or after the age of 49 to 50, you should get to see the doctors and understand. So the protocol about 1 to 2 years is still variable, and we still recommend every 2 years for Asian women. But if you have got a family history, and or you have got any of the risk factors, we talk about obesity, we talk about alcohol intake, and we talk about poor diet management, we talk about pregnancy, late pregnancy, no siblings, your risk increases, and we advise mammogram every year, because we have seen the data, we have seen the statistics, and we know that the risk of cancer does exist, especially 40 to 49. Now, women at the age of 55 and above, older basically, we encourage every 2 years to be fine. In an American society, in Australian society, they even recommend up to 3 years, but they have the data and statistics. But on the other hand, we are seeing more and more women today living longer and longer into the age of 70s and 80s, and the number of breast cancers in these women have increased tremendously. Minding the fact, we encourage the younger women, do not neglect your mothers and your aunties and your grandmothers at home, because if they don't get regular screening, they may be a following candidate for breast cancer, and sometimes detected rather late. And this is an issue you do not want. Women with risk factors, as basically those with family history, we encourage even from the age of 25 to 30, get to see your doctors, get ultrasound, and even mammogram if you've got 2 members of family with breast cancer, then you need to have mammogram done every year, including an alternate MRI of the breast, because breast tissue in the young is very dense, you may not be able to see very much, so you may have to do an alternate MRI every other year, and that is how we can detect early breast cancer. Now, we encourage all of you to join us in the fight of this disease, because breast cancer is curable if it is detected early, and this early detection is only by regular screening, and there's no other way of doing this. At Beacon Hospital, we are led by a team of multidisciplinary consultants as well as allied health staff. When we use the word allied health staff, we include everybody in terms of good radiology. We are talking about physiotherapy, pain therapy, excellent range of oncologists basically, and all this will strive to improve the quality of life for our patients at every phase of the disease, from early detection, diagnosis, treatment into supportive care. And that is important because at the end of the day, the outcome is not about having to just remove the tumor. It's about having to have early detection, successful management, and of course, we have the best outcome. At Beacon, we care for you, and your health is our priority.